Welcome everyone to Nursing Mode. Today, we're keeping microbiology simple. We're comparing acute, chronic, and latent disease. So do not make this harder than it needs to be, okay? So for testing, the easiest way to separate this is by timeline. Acute means it comes fast and usually does not last very long. Chronic means it's something that's developing slowly or is staying for a long time. Latent means the pathogen causes an infection, then hides or goes dormant, like he's sleeping there. And later he wakes up and it like boom, you get the condition. So quick memory line is this. Acute is like fast, chronic is like long time, and latent is like he's hidden, like and all of a sudden, boom, he wakes up and you get the condition. Now, let's start with acute part. Acute basically means quick, okay? So the symptoms start suddenly, and the illness usually lasts a short time, like a few days or a couple of weeks. So a simple example would be like influenza. A person may feel like, fine first, and then suddenly they have fever, chills, body ache. Oh, I cannot go to work today. You start coughing and you have fatigue. So it just comes fast, and in a week you're good. So for most people, this kind of acute conditions resolves in a really short period of time. So you recover and then you go back to normal life. So when a test question says sudden onset, short duration is acute. Okay? Just remember, acute arrives fast and leaves fast. Now, what is chronic disease? Chronic means a long time. So it usually develops more slowly and it can last for months, years, or your whole life. So a chronic disease often requires ongoing care. That can mean regular appointments, labs monitoring, medication, lifestyle changes, and a lot of patient education. So for infections examples, you could think of something like HIV or chronic hepatitis C. Non-infection example, you could be asthma, diabetes, hypertension, osteoarthritis. So the big testing difference is that chronic disease is not a quick episode. It's something that the patient manages over time and usually lasts forever. Also, something acute can turn into something chronic. You start like, oh, it's no big deal. You start complicating, you get worse, and you end up with something chronic. Okay? Chronic just means again, long time. Okay? Now, finally, let's talk about latent disease. Latent means the pathogen is not gone, it's just inactive. So the person has initial infection and then the pathogen goes dormant, like sleep, so in the body. So later, sometimes months, years, you know, he just reactivates, he wakes up. The reactivation may happen with usually stress, illness, the immunity went down, or any other trigger. So classic examples of this could be something like herpes simplex virus or varicella-zoster virus. So varicella-zoster is one of that causes the chickenpox. So he can go dormant, and later in life, the same virus can reactivate and causes shingles, right? Okay, so for the exam, if the question says dormant and reactivated later, the answer is latent. So quick check. If symptoms persist for months, years, or a lifetime, that's chronic. If the pathogen goes to sleep and later he wakes up, he reactivates, that is latent. If the disease starts suddenly and lasts a short time, that's acute. Okay? That's the whole pattern. Acute fast, chronic long, and later latent is hidden that then he returns or wakes up or he reactivates. Simple.